Hello everyone, my name is Felicia Rufus, and I want to talk to you today about secondhand smoke, and this is my persuasive speech. Secondhand smoke is very dangerous. Secondhand smoke kills approximately 600,000 non-smokers worldwide a year, and out of that 600,000, approximately 165,000 of them are children, and that is a terrible shame. The chemicals in the tobacco can reach your lungs very quickly. So every time you inhale, they are damaging your lungs, and you're not even the one that's smoking. There are about 4,000 toxins and chemicals in cigarette smoke, and out of that 4,000, there are about 50 carcinogenics and additives, which are very, very addictive. Here are just some of the additives that are in tobacco and cigarette smoke. We have formaldehyde, and we know that we use that to embalm dead people. We have ammonia. We use that to clean our houses. We have tar. We have nicotine. And we even have acetone. And that is what the ladies use when we go get our nails done. They have acetone. That is just a few agents that are additives that are in cigarette smoke, and we inhale that, and people smoke that. There are many secondhand smoke diseases and illnesses that is related to secondhand smoke. We have heart disease. We have lung cancer. We have, in pregnant women, it could cause sudden infant death syndrome. We can have acute respiratory infections. We can have problems with our bronchial tubes. It can cause ear problems and severe asthma in children, just to name a few. Breathing secondhand smoke makes you a forcible passive smoker, meaning you're not the smoker, but just being around someone smoking puts your life, your health, and well-being in danger. A mere 30 minutes of exposed to secondhand smoke can increase your levels of carbon monoxide, and it can also raise your blood pressure and pulse. That is something, huh? So what can we do to help prevent secondhand smoke and prevent it from causing us to have more health problems? Because secondhand smoke can also cause premature aging. It can cause blindness. It can reduce our ability to smell and taste. It can irritate our eyes, make our throat sore, makes us cough, and sometimes it even can make you nauseous. So we have to have some type of prevention with stopping people from smoking. We need to have prevention to let our teenagers know smoking is dangerous, not only to you, but to everyone around you. Secondhand smoke can put you at a high risk factor for having health insurance. A lot of insurance companies say if you smoke, a lot of insurance companies don't like to carry you. It can affect just your everyday life. Secondhand smoke for me has affected and touched my own life. My father has been a smoker for over 40 years. So he smoked around me and my entire family. And as you know, I spoke about my son having Hodgkin's lymphoma, but my mother, about 3 or 4 years ago, had fallen ill, and my mother's a nurse, and nurses and doctors, they don't think they need to go to the doctor. They feel like they know it all. So my mother became ill, and I was forcing her. I said, Ma, I think you're losing a little bit of weight, and I want you to go to the doctor. So to make a long story short, my mother finally went to the doctor, and the first diagnosis was she had skin cancer. And so the doctor wasn't happy. He felt like something else was wrong, so she went to go see another specialist. And once she saw that specialist informed her that she had to have emergency surgery because she not only had skin cancer of the face, she had bladder cancer, and she had kidney cancer. And the doctor also wanted to know, has she been a smoker? And my mother has never smoked. But she informed them that her ex-husband has smoked for over 40 years. So as a result of secondhand smoke, my mother lost a kidney and part of her bladder. She was forced into, to save her life, to take chemo and radiation. The doctors didn't give her a good diagnosis, but she's still here, and we don't have any good news, but the good news is God is good, and she's still here. So if you would just keep my mom in your prayers, and that is why I did my paper on second-hand smoke, because not only does it affect the smoker, but the person around. Secondhand smoke continues to be a big problem in our community, and something needs to be done, because it's in the air, it gets in our clothes, it gets in our hair, and it continues to be just a nuisance. So if you know someone that smokes, or if you are a smoker, please think about who you're harming besides yourself. Think about your family and friends and how you will want them to stay here for a long time along with yourself. So please, if you do smoke, stop. And if you don't want to stop, please think about your loved ones and your friends and your family. Dude, go. I think he's